For asking.
Thanks for joining us. Today, we're going to be talking a little bit about the CDC's recommendations of wearing masks in public and kind of the topic that came up this weekend on those conversations. Can you tell us a little bit about what those CDC recommendations are?
Sure. Yeah, the CDC came out and it was also highlighted by President Trump that the CDC is recommending the use of cloth masks for the public when they are in public places where social distancing is challenging. So the great example of this would be like the grocery store or the pharmacy, where it's really hard to do very good social distancing, and there's a lot of objects around us that could act as a nidus for viral transmission.
So when people are wearing these masks, you mentioned that they're doing this in hard to social distance type atmospheres. Should they still be social distancing? What are the rules? Do the rules change when you wear a mask? Is it still just as important to do all that other stuff?
Yeah, let's take a step back and actually say, what does a cloth mask actually do? And so wearing a cloth mask, and this needs to be distinguished from a surgical mask or an N95 mask that healthcare providers wear. We need those masks in the hospitals and in our clinics. Okay, the mask that the CDC is talking about is a cloth mask, a mask that you make at home with a bandana, a shirt, or any other kind of fabric that they've identified. The whole point of wearing a cloth mask in public is not to prevent or to keep the person wearing the mask safe. It's really to prevent transmission of the virus into the community. And so data that has come out in the past 2 to 3 weeks really highlights the role of the asymptomatic person being infected and shedding virus. And so you can have this virus in your nose and you can transmit it and you may not have any symptoms. And so what the cloth mask does is it prevents that viral transmission from the person that has the virus in their nose or in their mouth into the environment. It doesn't protect the person from getting the virus from an infected person from a cough or a sneeze. And so we really need to highlight that wearing this mask is really an additive benefit to the community by decreasing the chance of this virus coming from an asymptomatic person into the community, such as in a grocery store. But we really need to highlight the difference between that and a healthcare worker mask, which is a procedural mask, a surgical mask, an N95 mask that protects the healthcare worker from getting the virus. So it's really important that we make that emphasis. Now, the other thing we really need to highlight is that wearing a mask by no means makes or changes anything about the recommendation of social distancing. The most important thing that we all need to be doing is socially distancing ourselves. I'm here in my house. I'm not in the clinic or at work because I'm doing my part to keep everybody safe. We still need to focus that as being our number one priority. But if you do go out, and particularly going to areas like the grocery store, those high traffic areas that you need to go out to get supplies for your daily life, wearing a mask is not a bad idea, because in the small chance you are infected and just are asymptomatic, you're preventing that spread of virus from yourself into the community by wearing a mask.
Are there certain materials that you wouldn't recommend for a mask? I've seen some things floating around about like ski masks that a lot of people in Utah already probably have. Are there certain materials that are better than others that we recommend or the CDC recommends?
The CDC has a nice section on their website that really goes into detail how to make one of these masks. In brief, it's the thicker the material, the better. So if you can hold up the material and see through it, or even see the fibers of the material, that's not a very good mask. And in those cases, you really need to kind of double or triple layer that to make this an appropriate mask. You really want something that has pretty thick, dense fibers that you can use to cover your nose and mouth. And there's lots of good tutorials online in how you can use this by double folding a bandana, different t-shirts, and other different materials. Many people have ski buffs, and just one layer of a ski buff is not going to be that protective. You'd really need to fold that 2 or 3 times and maybe even put an additional piece of material in between one of those folds to really make an effective mask.
And also, I know the virus can also be transmitted into your eyes. Is that correct? So does a mask help in its entirety if you don't have glasses on, or you don't have any sort of eye protection on? Is it beneficial to still be wearing one?
Yeah, so keep in mind why we're wearing the mask. We're covering our nose and our mouth because that's where virus goes from us into the community. Virus doesn't leap out from our eyes into the community.
Right.
Okay,
Mm-hmm.
so we're wearing this mask to prevent that transmission from us to get out to the community. So if you wear a mask, that virus can't escape from your nose or mouth. The eyes have nothing to do with that. The eyes are really, we need to protect them from healthcare workers in terms of people that are infected, that we are getting the virus from them. So in the community, no, we don't need to cover our eyes, just our nose and our mouth.
That makes sense. Also, if you're out social distancing on a hike or going for a mountain bike ride or trying to get some outside activity, should you be wearing a mask there? What if you run into someone? What are your recommendations for that?
Yeah, those are areas that's going to be really difficult to wear a mask. We really need to focus there on social distancing and good trail etiquette. I was on a hike this weekend. When people come up, giving people a wide berth, at least 6 feet, is really what we should be doing from a trail etiquette standpoint. Wearing a mask in those areas it's much easier to do social distancing there than it is in a grocery store or a pharmacy. So I would just say good trail etiquette and avoid the masks while you're out running, hiking, and biking.
Yeah, and with that too, I would be careful where you're going for all these like hikes as well. You got to think about the fact that if you're going somewhere, a lot of people could also be going there. So being cautious of where you're going, and if you show up somewhere and it's packed, probably making that decision to go somewhere else.
Very good point, man. And really looking at that parking lot and making sure that you can distance yourselves in the parking lot, on the trail, really trying to find areas that are, densely or that are not densely used. Again, that's hard, especially right now when we have a lot of snow up high. It's dry down low. People are using those trails that are pretty common to us, but also get pretty packed.
We just had a comment made about how cloth masks can also help us remember to not touch our face. Do you feel like that's something that's super beneficial to also wear a mask because of that? Or is that just an assumption that people have for false sense of security?
Yeah, that's hard. There has been some studies out there that shows that wearing a mask actually increases the amount that people touch their face. They're fidgeting with their mask, they're adjusting it, and so they're closer to the face. So yeah, in theory, it could, act as a good reminder not to touch the face, but in reality, we don't really know how much that is true. And we worry that people are actually touching their face more by wearing a mask to adjust it.
Yeah, I feel like I've seen a couple of people do that. And I know when you get told not to touch your face, I feel like you instantly go to touch your face. It's kind of the opposite of what you're supposed to be doing. We also had a question come in from one of our own caregivers who asked about her parents who live in Utah. They had plans to travel later this summer, specifically in May, and the state's directive of stay safe, stay home ends in April. So they're having plans to still travel. What are your thoughts on travel plans, and should people be making them right now, or how do we know when it's safe to kind of live in the normal again?
This is a really hard question that we're struggling with both here locally at the state level and also at the national and international level. When is it appropriate to give kind of the all clear? When can we go back to kind of life as we know it? And we don't have an answer to this. My suggestion would be remain flexible. I would not make any travel plans for at least the next 2 months. Yes, the state's directive ends at the end of April, but I can tell you the modeling that we've looked at shows that the peak infections for Utah may not be until April 21st to 23rd. And so when you start thinking about that being the peak, and then you need at least 2 to 3 incubation cycles, which are 14 days each, that pushes it out into the end of May. And so I would say that we're most likely going to be in this kind of shelter in place atmosphere for at least 8 weeks, if not longer. And so I would say I would not make any travel plans for the month of May. And in fact, I probably wouldn't make any travel plans for the month of June. We're going to have to remain really flexible in this, and it's going to be a sacrifice for everybody. Fortunately, airplane, people, Delta, and those folks have been very receptive to changing plans and refunding and those types of things. I would take advantage of that. The last thing we want to do is get up and over this hump, and then people start getting out in the community too early, and then we see a second rise in cases. That would just be tragic. And so I would say, don't make any plans. Anticipate that we're going to be in this situation for at least 8 to 12 weeks. And it's really going to be on a week-by-week basis.
And it probably depends on what the rest of the country is doing too, because like it's been mentioned before, viruses don't respect boundaries. They're not going to just stop because Utah is doing a good job. So I think it's important to talk to neighbors in other states and see how they're doing and how their state is looking at data and everything as well too.
You're so right. And it's really hard to look at the United States as a single nation epidemiologically, because what you've seen is this huge hit in New York City. You're seeing it now in Louisiana. You're now seeing it in Michigan. And then we're going to see other states and other cities, hit their height of their epidemic in the coming weeks to months. And it's not uniform. And a city may have gone through their peak and have been on the other side, and we might be in the thick of it already or currently. And so it's going to be really hard, and it's going to take a lot of kind of forethought in terms of travel in the U.S. And consultations with experts and epidemiologists in terms of what's safe and what's not. I'd say what's safest, don't travel.
Yeah. And last question for you, the hospitalization rate of COVID, is it still kind of following the same path that it was before? Or have we seen an increase of hospitalizations over the last couple of weeks at all?
Right. So we're still kind of backing up one step. We're still looking at about a 5% test positivity rate, meaning everybody that's being tested, only about 5% are positive. And so that's a pretty low number comparing us to other places in the US. So that's a good thing. The second thing is our hospitalization rate. Our hospitalization rate still is hovering right around 10%. Compared to other places nationally, that's 20%. So we're actually in a good spot there as well. We are seeing cases, new daily cases increase, but the increase is right at about 10 to 15% per day. So those are all positive signs. They're positive signs that Utah so far is weathering this epidemic well, and that we're slowing the epidemic, and that we're quote unquote bending the curve. It's going to take more time, another 10, 14 days to really assess what the trajectory of Utah is. Utah is unique in a number of ways. One is that we've got a big population of young people. And so that makes our hospitalization rates lower because young people are less likely to get hospitalized. And two is we're not as densely populated as New York City, Seattle, Detroit, some of these other areas. We have a little more room, and so there's less likely person-to-person transmission to the levels in other places. So those are all things that are likely factoring into the epidemiology here in Utah. But again, it's speculative in nature. This is a novel virus that we're learning about every single day. And so we really have to take this day by day and remain flexible.
Okay, we had one more question come in. People want to know, if you had COVID-19, is it possible to get it again?
Right. Again, keep in mind our knowledge of this virus is maybe 14 weeks old. Okay, that is all the time we have had to study this infection. Okay, so keep that in mind. What we know from other coronaviruses. So there's 4 coronaviruses that cause the common cold. We get these viruses repeatedly. Our immunity to these coronavirus lasts anywhere between 2 to 3 months to maybe up to 1 year. And then that immunity wanes and we can get reinfected again. Contrast that with what's called MERS-CoV, another coronavirus that causes severe respiratory infection in the Middle East, where if you get infected once, you have long-standing immunity. The original SARS back in 2002 and 2003 didn't really elicit any long-standing immunity. And so what we know is that you're going to develop an antibody response that's going to identify people that have been infected with this virus, but we don't know what the durability of that response is. We have a hunch that you probably are protected for at least a couple months, but whether or not you have long-standing protection against this virus is yet to be understood from the immunology side of things. So again, it's an active area of science, and we'll know more, in the coming months.
And along the lines of the antibiotic test or antibody test, there's been talk about a test like that as well that's possible to see if you had COVID-19. Is that something that's going to happen soon? Are people going to be able to access that test, or is that something down the line that eventually we'll be able to do that?
So the first antibody test was approved just last week. So let's make the distinction between an antibody test and the test to detect active infection. The test to detect active infection is a swab that goes in your nose or your mouth, and it looks for the actual virus, the SARS-CoV-2 virus. And so it detects whether the virus is present or not, yes or no. What you're referring to is an antibody test, which is a blood test to see if your body has developed an immune response to that virus, the SARS-CoV-2 infection. And so that test really determines whether or not you've been infected and have had an antibody response to it. The antibody test, the blood test, will likely be coming on board in the next, I would say, few weeks. It all depends on if there's other vendors that start offering this test as well. For example, ARUP, the CDC, other things like that. I suspect we're going to start seeing this test more commonly used in the next few weeks. It'll probably be a little bit longer until it's available for widespread public consumption. But it is coming. It's just one of these things. It's a new test. We had to develop it. You have to validate it. You have to make sure it means something, and then get it out to the public. More important right now is the detection of active infection with the current test that's available.
That makes sense. Anything else you want to tell us today, Eddie? Anything else we should know right now?
Yeah, I mean, I think all this talk about masks is great. It's well and good, but we have to keep our focus on the social distancing, or what we call physical distancing. Now, we want to be social through means like this, but we can't be interacting with people. That is the cornerstone right now of controlling this epidemic. Masks, they augment our ability to keep the community safe. They by no means replace anything about physical distancing. The key to this is stay home. If you have to go out and are in areas where social distancing is hard, that's when you wear a mask. By no means should a mask be your ticket to get out of the house and go be social. Okay, and we have to emphasize that. And we have to emphasize that the masks you wear out in the community are not the ones that we use in the hospital and the clinic. These are ones that you make at home. The ones that are surgical masks, procedural masks, or N95s, they have to be in the hospitals. They cannot be out in the community. We need them more in the hospitals.
That makes sense. Thank you so much for joining us today. We really appreciate it. And if you guys have any questions about COVID-19 and would like to speak to someone, you can call our COVID-19 hotline at 844-442-5224, or you can visit our website at intermountainhealthcare.org. Thanks, everyone. We'll talk to you later. Bye.
See ya.